Good afternoon, and thank you for standing by. I'd like to inform all participants that your lines have been placed on a listen-only mode until the question-and-answer session of today's call. Today's call is also being recorded. If anyone has any objections, you may disconnect at this time. I would now like to turn the call over to Ms. Amy Romero. Thank you. You may begin.
Thank you. Welcome, everyone. My name is Amy Romero, and I am a TOR GPO. Congratulations on your new award. We are very excited to start our new TOR cohort with 92 new grantees. Today, we will discuss the Government Performance and Results Act, GPRA tool, in detail, and we will also talk about the SPARS system. We have invited the experts on this topic, and they will present for us today. Please note this presentation will be specific for the Tribal Opioid Response Program, so the requirements that we will discuss today are specific for the TOR program. If you are a COVID-19 program, a new grantee funded under the COVID program, please contact your GPO if you have any questions. Your requirements are slightly different, and we don't want to create any confusion. So please contact your GPO with any questions. We will take questions for everyone else at the end. At this time, I will turn it over to William Longinetti. Thank you.
Hi, everyone. This is William Longinetti. Along with Amy, I am a public health advisor at SAMHSA and a project officer on the Tribal Opioid Response Grant. Thank you all for joining us today. I would now like to turn it over to your presenters for today, Dr. Darren Fulmore and Dr. Majid Karimi with our Center for Behavioral Health Statistics and Quality. Thank you.
Thank you, Amy. Thank you, William. I hope you can hear me okay.
Yes, we can hear you.
Okay. Well, good. Great. Well, good afternoon, and I'm excited to be presenting the TOR program performance monitoring accountability, as well as discuss the SAMHSA system for collecting data on your performance monitoring responsibilities. I am here with my colleague, Dr. MJ Karimi, and we're going to give an overview of not only the system where you will be providing us in detail how well your programs are doing, because I'm sure they'll do very well, but in addition to that, we'll give an overview of essentially why you are collecting this information. So for today's discussion, here's our highlight outline. I'm going to talk about the why first. That is the Government Performance and Results Act, and or GPRA, prior to getting into the system where your GPRA data is not only collected from you to us, but also an overview of the system so that you are clear on the roles and responsibilities on your side and the roles and responsibilities on our side. So to that end, I, as well as my colleague, Dr. Creamy, will talk about SPARS. We'll also talk about, in some detail, the tool that you will use to collect your GPRA data, give you some examples, some reports, as well as some of the other features that are inherent in SPARS, including some trainings and other technical support aspects of this system. Finally, we will give some time for some questions. While we're going through our presentation, feel free to use the Q&A chat feature and as part of this WebEx functionality, and during that time, either myself or MJ, depending upon who's presenting, may be able to respond to all using that feature. So that way there's no delay if you have some questions and you'd like those answered right away. So let's talk about the why, the Government Performance Results Act. So the law first passed in '96 and then updated in 2010 is the government's way of saying we're giving you this money and we want you to be accountable. How are you accountable? You tell us not only what you're going to do in your funding opportunity announcement when you submit your application, but SAMHSA, in relationship with you, we would like to look at those performance targets. Those targets are then submitted into SPARS. You report your outcomes to us. some cases there may be some evaluations that you do on your own. Sometimes SAMHSA conduct those. When the Act was updated, what we wanted, the government wanted, we being the public, not only just wanted to know your outcomes, we wanted to know lessons learned, how do you build upon success and or lessons learned, as well as, let's see if we can improve what we've learned for maybe the next cohort, the next program, updating our measures. So there's always a continuous quality improvement aspect to performance monitoring and performance management. So a little bit about your GPRA responsibility. So as you know, in your application, your funding opportunity announcement said you have to collect data at the program and client level. So there's a tool for that. SPARS allows you to enter this information in the system. If there's more information, will be provided about this soon, and of course, the soon is now. In addition to that, you're responsible for collecting some program-level data quarterly. What is that program-level data? It's the level of kits that you may or may not purchase as part of your program in addition to distributing those. We'll give a little bit more detail about this later. But in summary, you have the responsibility to collect client-level data for the individuals that you see. In addition, you have program-level data you're collecting 4 times a year. So just think federal fiscal year quarterly, you enter that information. You can use up to 25% of your award for data collection and performance assessment. So what goes into this client level? Well, in addition to some basic background information like demographics, gender, race, ethnicity, age, we're also collecting information on diagnosis, the kinds of services you plan and or provide, HIV status, drug use, etc. This is entered in the SPARS, and as mentioned early, and per your FOA, you can use up to 25% of your award for performance management. So when do you provide us this information? You have a target. Let's just say, for argument's sake, it's 10. So it's 10 a year. So if you're supposed to see 10 clients a year, that is your goal for your grant. So that would be 30 altogether. So our expectation would be that you would do an intake on 100% of whatever that target is. Say it's 30, 10 a year, that's our expectation. In addition to that, your program may be responsible for collecting this information quarterly. That means, are you collecting at 3 months, post-intake, and at 6 months? In addition to that, you may have discharge. So your discharge can come at any time in the treatment process. Usually when clients are having some kind of medication-assisted therapy, they have a long-term relationship with the programs they're dealing with. So it's not likely you'll be discharging them before 6 months, but it is possible. But as stated earlier, you have the responsibility for meeting your targets and entering at all of these milestones. If because of this period that we're in, COVID-19, you can't see your clients in person, then on a case-by-case basis, you'd have discussions with your GPO as to perhaps doing these interviews virtually or telephonically. Those are things that you'd work out with your project officers so as to make sure that the logistics and the confidentiality and other aspects of the interview are handled appropriately. Our tool has a number of sections. For the baseline or intake interview, you'll be entering sections A through G. Each of these sections, which we'll provide in detail later, are components of the tool that ask very specific questions. For example, Section A is asking a lot about the background information, diagnostic. Section G will ask about certain outcome measures that we'll provide some detail about later. You provide a very unique client ID, like a patient ID, for all persons served by your program. And as stated earlier, you want to, at a minimum, see 100% of those that you initially provided as your target. If you exceed that, great. But if you're going to have issues getting to that target, you definitely want to make sure you talk to your GPO so that perhaps there's some need of technical support that can be provided to make sure you meet your goals and objectives. So as stated earlier, this tool is broken down in certain sections. For the intake, you have sections A, and then you have what we call our outcome measures B through G. As stated earlier, there are other milestones like your 3 and 6 month follow-up. So for your follow-ups, you have section I. That's essentially you'd only complete that during the follow-up interview. If for some reason you cannot catch up, the client refuses, they discharge, you cannot contact them, we still require an administrative follow-up. And basically that includes you using your patient or client records, completing Section A, that's a record management, any background information from the file that you can glean, and Section I, which is essentially a disposition on that client at that follow-up period. We do require a follow-up rate of 80%. So if your target was 10, you did an intake on 10, then at the very least, you'd want to do a follow-up with 8 of those at your respective follow-up periods. Discharged, well, again, you'd be completing the same parts of the tool, A through G, records management through the outcome measures, that's B through G, and then there's J and K. Dr. Cream is going to give a little bit more detail about those, but essentially we want to know what services that you provided, and K, we want to know the disposition of the client at discharge, like where did you discharge them to, did they leave against medical advice, etc. Again, if you're unable to catch up with the client, we still require an administrative discharge. And again, these are the kinds of information that would go into the administrative discharge will be things that you can pull from the client's file. For discharge policy, for whatever reason, again, you cannot contact the client after 30 days. You've reached out to them, you've done your level best. It's at that time where you'd want to start conducting those administrative discharges or administrative follow-up as well. So, again, we have both client level, I just outlined that. We also have grantee or program level. So what happens at the program level? So every quarter, as part of your grant, there are 3 questions that we ask. So not that many, right? So essentially we're going to be asking you that if there's an availability to distribute kits, essentially what we're asking. So did you purchase the kits? And are you going to distribute them? If the answer is no, the interview is over. You're not intending on purchasing anything. So you've answered one question. If you did purchase them, then the idea is, okay, are you going to distribute them? And the last question is, how many did you distribute? So every quarter, that is a requirement of your program. So a little bit about SPARS. So SPARS, or SAMHSA's Performance Accountability and Reporting System, that is our centralized data repository where you will be reporting your GPRA data, be it the program level for kits or the client level. So at this time, most, if not all of you, will have your account set up. If not, that should be happening very shortly. Upon the setting up of your account, you will have access to all the resources of SPARS. That includes the tools, the measures, being able to enter your data, and in a short while we're talking about the other features of SPARS, including report generation, as well as any recorded trainings of background materials that we have on performance monitoring. This is the website for SPARS, so if you type in that, this is what you would see. Okay? So for grantees, as stated earlier, with SPARS, you can submit your data, you can download your own data. We'll talk about how you can generate your own reports and what they look like. There are other resources, I stated that earlier, including recorded or pre-recorded trainings. You can request technical support, mostly from, lockouts of accounts and how to reset your password to, hey, I'm having trouble reaching out and finding my clients. What are ways that I can look and improve my capacity for doing my follow-up so I can keep in line with my performance requirements? In addition to that, I mentioned earlier, there's some recorded trainings and other downloadable resources to make sure that your account is current and making sure that any turnover in staff, they have the capacity to re-review materials that the project directors have. And again, as stated earlier, if your account has not been set up, it will be over the next week. How do we find these tools? Once you go to the SPARS homepage, there's a link that says Data Collection Tools and Resources. Your tool is housed under the Center for Substance Abuse Treatment. So when you click that, it's color-coded. You can find your client-level tool. There are other tools that are there for other programs. You scroll down, and you'll see something that says client-level tool. There's also one that says program-level tool. That's a paper version of being able to look and find questions for the kits that you would ask, that are asked of you 4 times a year or quarterly. So at this time, I'm going to pass the ball over to my colleague, Dr. Karimi, who is going to give a little bit more detail about the specific aspects of SPARS. Dr. Karimi?
Yes, thanks, Darren. Can you hear me okay?
I can, perfectly.
Wonderful. Good afternoon, everyone. As Dr. Darren Fulmer mentioned, my name is MJ Karimi, and I'm a social science analyst at the Center for Behavioral Health, Statistics, and Quality. I'm going to talk to you about the different section of SAMHSA's GPRA tool and the outcome measures that are collected. I'm sure that most of you are somewhat familiar with this section as well as their related questions. Section A of the GPRA client level tool includes info on behavioral health diagnosis, age, gender, or ethnicity or demographic information at intake, and services planned at discharge, as well as military deployment information. First and foremost, I wanted to provide you with a screenshot of a paper version of Section A, or better say, the beginning of Section A on the GPRA tool, which looks like what we have on this screen, and I hope it's readable enough. This form can be completed by hand, or if you have a tablet, you can easily log into a SPARS system to complete your client interview there firsthand. The next slide represents some additional information on the form itself. As Darren mentioned, in 2018, SAMHSA added diagnostic information, or ICD-10, to all its GPRA instruments. I have to say that SAMHSA is not only interested in learning about clients' demographic information that includes age, gender, race, and ethnicity, but it is also interested in knowing about the appropriateness of services that are being provided to the clients. And the only way to access this information is by receiving the diagnostics data directly or indirectly from you as SAMHSA's grantees. You as a clinician can select up to 3 diagnoses and indicate which one is primary versus secondary or tertiary. But please make sure to select at least 1 diagnosis here. In most SAMHSA's grant programs, the requirements are based on substance use disorder or co-occurring substance use or mental health disorders. This information is vital to our day-to-day operation and help us to ensure that eligible individuals are enrolled in SAMHSA's program. Dr. Fulmer talked about planned services and the importance of correctly identifying the services you plan to provide your clients during the course of their treatment or recovery. This is a screenshot of the planned services section of GPRA tool, which includes different modalities. For example, case management services, medical services, or aftercare services, just to name a few. Section B of the GPRA tool is related to drug and alcohol use. And it's important to remember that this section pertains to drug and alcohol use during the last 30 days. Section C. Here, you will have questions about participants' family history and living conditions also pertaining to the last 30 days, required to be collected for each interview. Note that Section B through Section G are the beginning of what we call national outcome measures, or NOMs. Section D is about education, which has two subparts. First, attendance at a school, and secondly, grade level completion. I should emphasize that depending on the age of the client, some of the questions in this section may not be applicable to the participant. Section E, this is a section on crime and criminal justice status of the client. Depending on their status, sometimes clients opt out or may consider opting out due to confidentiality concerns. At SAMHSA, we 100% guarantee confidentiality and encourage all participants to answer this question, and we have observed that in many cases they do answer this question. Section F relates to mental health problems, physical health problems, and treatment recovery that the participant may want to report in addition to any violence or trauma items that they have experienced in the past that they would like to disclose to us during the initial interview. Next, Section G asks the participants about their social connectedness. This is essentially what clients perceive as their social network, such as family, friends, and acquaintances, or even in some cases, the presence of social media in their lives. Just a quick note again that Section B through Section G are required for all milestones. And by that I mean intake, follow-up, as well as discharge. Next is Section I. This is conducted at your 6-month follow-up. And again, you should complete Section A through G and then enter Section I, which contains specific questions that are geared toward the interviewer, as well as some administrative questions that you as an interviewer should respond to. When completing the discharge interview, you don't complete Section I. You must complete Section J and Section K in addition to filling out Section A through Section G. This would provide SAMHSA with all the needed information regarding the discharge status of the client. Section K is completed at reassessment and clinical discharge, and the very important items here, again, are the section about what services are planned and what services are actually provided to the client. There are questions here that we want to make sure that interviewers respond to, and that these questions are never asked from the client. We look at the planned services in the previous slide. As a future reference, this is a screenshot of services received by client at discharge. It asks you to identify the number of days of service provided to the clients during the course of their treatment as well as their recovery. It also asks for a number of sessions provided on each of the categories, such as case management, medical care services, and delivery. Again, please make sure to fill out this section of the GPRA tool when you discharge your clients, either through clinical discharge or an admin discharge. This is a screenshot of where within SPARS the data is reported. You need to have a SAMHSA SPARS account to report into the system. In this slide, I highlighted some of the reports that are quite useful. For example, intake coverage report to give you an idea of the number of cases or number of intakes, 6 months follow-up change report, frequency report, 6 months follow-up notification report. If you click on the icon to the right labeled as detailed description, you can have access to entire narrative of what type of data the report is designed to provide to you. My favorite part, we have some samples of the reports generated by SPARS in this slide. On the right side, you see a screenshot of our data visualization report in which we have recently upgraded our system to. The idea behind this report was to develop a report that was graphically friendly and to provide users with different filter options, for example, by fiscal year, interview type, outcome change, gender, and other demographic information. We encourage you to take advantage of the data visualization report once you get your account set up and your data entered. And of course, on the left, we have an example of our old or legacy reports. So clearly, we have a comparison of our old tabular crystal reports on the left side and the new data visualization features of SPARS that provide you with nice charts and graphs. Please note that the ICD-10 and drug use filters were recently added to the menu, and in your program, there is no need to report or click on the best practices. This is a page that is accessible to all CSAP program grantees, and some are using best practices to look at the number of training sessions, for example, and the impact of the training that they are providing to their communities. One more important point here is that as a tour grantee, you should only include clients receiving individual treatment services on the target, not clients that are receiving prevention and or outreach. I'm going to show you some sample reports that you can generate through the SPARS system. Your GPO can run these reports as well, and your GPO can actually generate these reports as well. So as your program starts to mature by the passage of time, I recommend you to log in periodically to generate such reports to get an understanding of where your program is standing and what needs to be done next. We have a number of reports within SPARS. For example, the report on this slide is on NOMs or outcome measures. Essentially, when you enter certain type of or amount of data on a SPARS, you can generate this report. Specifically on this graph, we have abstinence, crime and criminal justice, etc., as your outcome measures. And you obviously want to perform in a way that you see increase on the right bar shown in darker red color. The numbers in green represent rate of change in each of these indicators. And these indicators, please note that they are from baseline to 6 months follow-up, and all the numbers in this graph show a positive trend. I personally believe this provides you with a great strategy to self-monitor your program time to time, and also allows you to take your concern directly to your GPO for clear instructions and resolutions. There are also other reports. We have programs that serve populations that are not only dealing with substance use disorder, but also considered to be at risk when it comes to HIV/AIDS. We run this type of report to see risky behaviors that the clients are reporting. This is a kind of report that you can generate once your program gains some maturity, and then a large amount of 6 months follow-up data are entered into a SPARS system. As you can see, some of the indicators in this slide, from intake to 6 months follow-up, or injection drug use, or if the client had unprotected sexual contact with someone who is HIV positive, etc., etc. Let's look at another example for a different CSAP program, just to bring some perspective in this. This is a bar graph on abstinence, and it breaks down the individual grant program and data by particular substances used. So on the left side, for example, we have the overall data on abstinence and then specific substances such as alcohol, cocaine, methamphetamine, etc., that the grantee is interested to study when serving a certain target population to see if they are entirely meeting their goals of the program. To sum this up, you may need to run your report starting with intake data and comparing them to the data you received from the reassessment rates. You can easily generate your demographic report as well as drug use and frequency reports on SPARS. In this example, we used frequency reports that are used and are useful in grouping specific substances being used, or in some cases, different illnesses or certain diagnoses. Other reports that are very common are 6 months follow-up change report or national outcome measures reports that depict the outcomes of risky behavior. Note that you can use this report individually or in conjunction with each other. These reports are very much helpful to support you and your program and to assist you with your performance monitoring. In the next slide, I talk to include some of the available and useful training that are available on SPARS. I personally recommend how to use the SPARS Online Learning Center. That one of the training, also SPARS Overview, Introduction to Follow-up. It's an hour training, and it's very useful. Advanced follow-up techniques, as well as using technology to improve follow-up techniques. And this is a screenshot of where you can find all this training. This is under the SPARS Learning Center. And as you can see in this landing page, you will have the opportunity to set up your calendar. If you take a look into the right side, the right column, then you can set up your navigations, set up your dashboard to let the system know what type of training you're interested in, so you can receive notification. If there is a new training, you will receive an email. And also take a look into upcoming events that you might be benefit from, just to participate and listen to those additional training that may come up. By now, all of you or most of you should have access to SPARS system. If you do not have access to SPARS system, there is a form. I included the actual form in the screenshot. It's called CSAT Grantee Information Form. You need to fill out this form and submit that to SPARS in order to set up your account. And if you do not know who is SAMHSA's branch chief, it's because that's one of the questions, it's fine if you keep that blank, but make sure that you submit the form to SPARS. And if there is any problem, please let Amy or William or any of your GPOs know about it. Some of the next step that I recommend to all of my new grantees are, please make sure to review the updated guidelines and data collection tools. As Darren was showing you, that was the slide that showed a color coordination, and I believe CSAT programs and all the Q by Q and GPRA tools are color-coded in kind of like a purple color. Again, the client's intake no later than 4 months after the grant award. Contact your GPO to discuss specific training or TAs related to GPRA tools. And if you have any questions in general, begin collecting and entering required data as soon as possible. Discuss any data collection question or concerns, again, with your GPO, and make sure that you do continuous quality improvement by running reports through SPARS, retain as necessary, keep your output data, keep your reports, so if you later on want to go back and refer to them, you have something to back that up. Seek any type of technical assistance and any need that you have from SAMHSA. And the way that you can contact the SPARS team is either by phone. Their number is 855-322-2746, or during this time that most of us are working from home, email might be more beneficial. Their email address is spars-support@rti.org. They are open from Monday through Friday, 8 a.m. to 7 p.m. Eastern Time. And with that, I'm going to open the floor, for any questions that you may have from me and Darren. Thank you.
Thank you. To ask a question, please press star followed by 1. Please ensure that your phone is unmuted and record your name clearly when prompted. And to withdraw your request, please press star 2.
And you can also type your questions into the chat box, or if you'd like to speak your question out loud, you press star followed by 1. And while we're waiting for some questions to come in, I saw a few people had asked in the chat if we will be distributing copies of the PowerPoint. And yes, we will be sending out a copy of the PowerPoint slides later today after the webinar. So you will all get copies. And we will also we have recorded the webinar, and we'll be posting a link to that recording sometime next week.
Hello, this is the operator. So there are no questions on the phone right now, but it looks like there are questions in the chat that they presented to the host privately. So if you could ask your question publicly so that everyone can see.
Yeah, it looks like just the 2 questions that were asked were copies of the slides. So I don't know if anyone had other questions for Dr.
I think that to clarify, we are in the process of setting up accounts. I did see some question about that. So again, hopefully by the end of the week, all of the new tour cohort accounts are set up. Once they are, the lead on the account, whoever on the program will get an email, and with that will come what MJ, Dr. Creamy has shown would be the grantee information form that you would return with any other staff that you would add to SPARS, or in addition to that, you would need to make sure your targets are in line with what you've discussed with your GPO.
So it looks like privately there are about 7 other questions.
Not necessarily. It really depends on how frequent you use it. After a while, it probably becomes second nature. Most of the time, the SPARS training is necessary for new people, turnover, those kinds of things, or someone who hasn't used it in a while. We do have recorded trainings in addition to handing out our PowerPoint. So if people have need to have a refresher, we do have SPARS refreshers, pre-recorded trainings online. And it's a pretty intuitive system, point and click, and enter the information just like it would be on paper. Clarify, and this will be in an updated PowerPoint, this cohort program is responsible for intake, also responsible for 6-month follow-up and discharge. You also have a program level, which is the 3 questions that are asked quarterly about whether or not you're going to purchase the kits, how many you purchase, and how many you plan to distribute. That's only asked 4 times a year. That is 3 questions, and you would enter that during, like, right on the fiscal year. So, like January and April and August or something along those lines. So 4 times a year. You can get access to the grantee information form now. You don't need to have an account for that. If you go to the SPARS website, www.SPARS.SAMHSA.gov, you would click, once you see that home page and you scroll down, you'll see a link for data collection tools and resources. And when you click that link, you'll see a whole bunch of tools that are used by grantees across SAMHSA. You would want to select the CSAT one, so it'll filter out all the other noise things that aren't going to be relevant to your program. And because these are OMB approved tools, they're public, so that will be available. You don't need a SPARS account for that.
Hi, Darren. This is Will. So for the grantee information form for getting access to SPARS, they should receive that from SPARS, right? SPARS will be reaching out to every grantee?
Right. So the accounts are set up. It's like an automatic email. You would receive that, whoever you are, the point of contact, and it's like a Word document. You would complete it, essentially who you are, anyone else that you would want to have access. Usually it could be like a site tech, someone that will actually be entering the GPRA data if it's not someone that's here. And in addition to that, you put in your target. Like you do it by a year, and then you would do it a total. So like I was saying, if your target is 30, you put 10, 10, 10, and then 30. There's no targets for kits because, again, that's can you go backwards? It's that yellow form. It's a yellow form, and it'll look like that. So along with the email, you'll get a form that looks like that, and you would click who you are and your grantee number. You are services grant, 6-month follow-up, and then you would enter any of the other relevant information.
Do you know if that email has gone out yet, or is that still?
It should be going out between now. Most grantees, because the information you provided me, I provided it to SPARS Help Desk, and you, along with I think there's like 3 other programs they're entering, they want to make sure they enter it correctly. So people should have their accounts set up. If you don't hear back from SPARS by, let's just say Monday, reach out to your GPO and or the SPARS Help Desk, and they'll follow up. I think what they're trying to do is to identify you as the Tour 2 cohort because this is the second one. And we want to distinguish that from the first group of grant because it is a new grant program. So we want to make sure that there's no overlap and there's no confusion. So does your account change from the first one? Yes, because you are a new grant. So if you try to log in and use your first tour, now you can use your same username and password. It doesn't really matter. But in a way, it's a new account because you really can't do anything with the old tour cohort information unless you have something like a no-cost extension where that account is still ongoing. But if your program has ended, if the first tour grant program has ended, no-cost extensions aren't available or you didn't use one, then it's essentially a different grant, treated as a unique grant that has nothing to do with the first. That's kind of how you would do it. And that way there isn't any confusion. So what we're having them do is to try to make sure they distinguish between the first one and the second one, especially for those of you who have both or did have 2.
And there's a question here. Is there a fillable tool on the SPARS website for clients to use?
No, this is a client interview conducted by the grantee. So it's not something you would hand to the client and they fill it out and hand it back to you. The SPARS tool online is a web tool, but it would be the assumption is always that it's the grantee that is entering the information, not the client.
And so when you complete the client tool, you could complete it directly on the SPARS
Sure,
website.
if you can do that. If let's say you don't want to deal with paper at all and you got a laptop in front of you, log into your SPARS account, you can conduct the interview that way. It really depends upon the personal preference. Some people want to fill it out by hand and enter it later. Others want to direct key it in. That's also okay.
It looks like someone is asking, is this training applicable to SOAR grantees as well in terms of GPRA and the additional SPARS quarterly data on naloxone?
It's identical. Think of the SOAR and TORs as brothers and sisters, except it's state as opposed to the tribal. But the GPRA responsibilities are the same with the kits and the client level and all of that.
And if you have both a SOAR and a TOR grantee, just speak to your GPO about how the data collection.
How to do case management, exactly. Because if you do have a relationship, or if you're you're the state and the tribe, you're gonna have to figure out how to manage those both, because you can't, I wouldn't say game the system, but if you have a client in one, you can't double count them in the other. Whatever fund you're using, whoever has possession first, that's where that client would be entered.
And again, if you want to ask any questions, you can answer those either in the chat or the Q&A, or I think you press *1, and then you'll be unmuted.
We have a question over the phone coming from Sasha Cernos. Your line is now open.
Can you guys hear me?
We can.
Hello? Oh, yay. So I just wanted to clarify the post-intake follow-ups. I see in the chat it says TOR grantees are only responsible for intake, 6-month follow-up, and discharge. But in the presentation, okay, because in the presentation it mentioned a 3-month.
Right, we made a correction on that. So when we hand out the slide deck, some of that is there have been some changes in some other cohorts where even though it's the same program, they switched to and added in a 3-month. So I got some clarification on that. You do not have a 3-month follow-up.
Beautiful. Thank you so much.
Mm-hmm.
You're welcome.
Okay, it looks like we had a few more questions in the chat.
There's a question. Hi, Darren. This is Amy. For grantees that are collecting the information using an iPad or a computer, what is the process of doing that? Could you explain to grantees?
What do you mean by process? You mean logging in, that kind of thing? I mean, if you want to use a tablet and as opposed to paper and pencil, I mean, SAMHSA doesn't get involved in that. The main thing is we want to make sure that the information is entered into the system. We don't kind of manage whether you want to do it by hand or write it down. If someone has a tablet and they're sitting in front of a person and they're doing the interview and they're typing it in, that's okay. The main thing is that they have to be responsible, they being the grantees, for things like confidentiality and the security of their respective networks.
Mm-hmm. And could they do the data entry directly on the data entry page?
Yes, if they log in the SPARS and they click themselves and then they start doing the interview, let's say it's an intake, you can enter it directly in there. You don't have to do it by hand on paper and then transpose it later.
Okay, thank you. There's also, there is also a question about the targets. So for TOR grantees specifically, when you put your target on the form, on the SPARS form, that should only be your treatment, the number of clients that will be receiving individual treatment services. For those grantees that will be having, that are doing prevention and outreach, and you're planning to do prevention with, an outreach with 1,000 people, we don't want you to include those numbers into your target. So your target should be specific to the number of clients that will be receiving individual treatment services. Those are the clients that are required to have a GPRA interview, not those that will be receiving prevention and outreach efforts. Thank you. And that's the only question I have.
Okay. And there is the opportunity, depending upon the volume of your programs, to do batch uploading. That's typically for programs that have electronic health record and they're doing thousands. We do offer that to TOR. Typically, it takes a while technically to set that up. If you've done that before previously, it's not going to have to be any change. Just make sure you contact the SPARS help desk and says, hey, it's me again. Just got a TOR 2 in the second cohort. I want to still do batch uploading, and they'll make sure that's available to you.
And we had a couple more questions in the chat. So if we have a no-cost extension on our grant and then also this new grant, and there's a year of overlap, does that mean they have two separate SPARS accounts now?
They do. You almost have to treat them as if they don't know each other. Now, can you, and this will be another question for another time, if we have more time, can you transfer clients between TOR 1 and TOR 2? But you have to make sure that the TOR 1 client has been discharged first, especially if the no-cost extension ends. But yes, treat these as two separate accounts. Do not treat them as if they're merging together. They're not. The no-cost extension is TOR 1. TOR 2 starts, 9/30.
Okay, and then another question. We have partnered with an urban Indian clinic for this TOR funding. They will be interacting with the clients. We, as the grantee, will not. Is it okay to let them enter the data into SPARS?
Again, it's how the grantee's personal comfort level. If they're okay partnering with someone else and allowing them to enter the data, again, it'll be the responsibility of the grantee to manage things like that from a secure standpoint. See, SPARS is housed in SAMHSA's cloud, so it's secure on our side. So you want to make sure anyone, it's like anything else that you would give someone your account, to make sure that they're managing it appropriately.
And then someone asks, we are using an upload service. We can still do this, correct? I think that you just answered that.
Right. If you are previously set up batch uploading with SPARS, it would still be available. If you want to use batch uploading with SPARS and you haven't done before, then you do want to contact the help desk to set that up. And again, it's a volume thing. Most of the programs that do this, they're treating in 1,000.
And then we have a question. We have to wait for IRB approval before administering the tool. Is it okay that data collection will not begin until after approval?
That's more of a programmatic question. You'd want to talk with your GPO about that because I understand that can be an issue on the grantee side. So that's something you do want to discuss with your GPO.
Yes, and regarding IRB approvals, I just wanted to add that in some cases it could take 6 months to get IRB approval. So SAMHSA does not require IRB approval for GPRA data collection. So we recommend that if possible to discuss with your GPO, let us know, but it is not a requirement. And if you could let your agency know that SAMHSA does not require IRB approval for GPRA data, as you are required to start entering data by January 30th. And that you may not be able to meet that requirement if you wait for 6 months for IRB approval.
And then I think you touched on this before, Darren. Our organization has a SOAR grant for another program and then this SOAR grant for our MAP program. Are we not to count people twice that are in both programs?
Exactly. No duplication. You want to make sure that who's ever managing that grant manages them until they don't, and then if they need to discharge them, they can. They'll have to use a new client ID if it's a separate grant. So this is very important. If you are the same grant and you discharge them, they come back later, same client ID. But if you discharge them and then they walk into the door, same door but different grant program, new client ID for MAP, new client ID for SOAR. You cannot have them, and you can't enter the same GPRA information for the same person 2 or 3 times if you have 2 or 3 grants at the same time.
And if the grants are providing totally different services, they can collect data on the client through the multiple grants, right?
No. So again, the same thing applies. It's basically, if you look at your grant responsibility, you talk to grants about this, there's something about not mixing funds, and I understand. Case management is one of those things. It could be a pain in the neck because it's like, wait a minute, I got 3 grants from SAMHSA. What you want to do is talk with your GPO and look at the kinds of case management you can do and how savvy and how original you can be in terms of making sure if I am providing comparable but different services because I have 3 or 4 different grant programs, maybe if, let's say, if you're the tour and you've met all of your targets, and I'm not saying you do this, then you might want to share that client, discharge them, and have the other grant take over so that you can get credit there. And then if there's another grant, you discharge them because the thing is, SAMHSA doesn't technically want you to be mixing funds with the same client, even though it happens all the time. But, again, that's one of those you want to talk with grants about because it's less of a data collection. It impacts data, but it's more of a case management issue more than anything else.
Okay. And then we have another question here. Our new tour grant has an alcohol use disorder component. Are we doing the same tool and data collection for both alcohol use disorder and opioid use disorder patients?
The client tool is on the approved, and it's going to be the same tool. There's no different tool. Whoever walks in and you're using TOR funds and you do the GPRA requirement, you use that tool. We do have an ICD-10 section of the tool just to make sure you enter that information, as Dr. Creamy said, so that we're capturing the appropriateness of services for that grant.
Okay. And I think those were all the questions in the chat and Q&A. Were there more questions on the phone line?
Yeah, I just recommend all grantees, if you have multiple grants, please contact your TOR GPO, and we will work with you individually and let you know how to do your GPRA entry if you have a grant in a no-cost extension and a current newly funded TOR grant, as well as if you have other grants or MAD-PADOA or other SAMHSA grants.
No questions on the phone at this time.
Okay, so we don't have any other questions at this time. I think we could end our webinar for today. Please feel free to send us questions via email. We will be sharing the PowerPoint presentation of today's presentation via email. As well, this webinar has been recorded, and the recording will be posted on our AIAN-ATTC website. Last week we had, actually on October 29th, we had our TOR orientation webinar that is already posted under the same link that I shared on the chat. Please, if you have not participated on the orientation webinar for TOR grantees, please listen to the recorded link, and we will be, we're starting to schedule conference calls with each new grantee. Thank you, and have a great afternoon.
Take care, everybody.
Thank you,
This
everyone.
does conclude today's conference. You may
Have a great day.
time.
Goodbye.
Speakers, please stand by.